With that, I'll recognize myself for 5 minutes. This question is to, well, first of all, I want to say thank you so much to everyone for testifying, especially to those who joined us earlier today. But Director Carroll, I'm particularly glad to hear that you are testifying about the importance of evidence-based treatment. And we actually see extensively in the GAO testimony that highlights that one of the key, that medication-assisted treatment is demonstrated that it reduces opioid use and increases treatment retention compared to abstinence-based treatment. One of the challenges identified in increasing access to MAT is really about access to coverage, right, and the availability and limits of insurance coverage for MAT. You state that patients with no insurance coverage for MAT could face prohibitive out-of-pocket costs that could limit their access to if coverage for MAT varied for those individuals with insurance, and coverage varied. Insurance plans, including state Medicaid plans, did not always cover the medications, and they sometimes imposed limits on the length of treatment. That said, I have a lot of papers here, by the way, sorry. That said, we have the study that I earlier introduced from the American Journal of Public Health that stated that the ACA provides greater access to substance use disorder treatment through major coverage expansions, regulatory changes requiring the coverage of substance use disorder treatment in existing insurance plans, and requirements for SUD treatment to be offered on par with medical and surgery, as well as opportunities to integrate substance use into mainstream healthcare. A Kaiser study, as mentioned previously, shows that 4 in 10 adults with opioid addiction are covered by Medicaid, and 21 million Americans have gained coverage through the ACA, including 12 million through Medicaid. So, Ms. McNeil, do you believe that if the ACA is overturned, this issue of coverage would be better or worse?
I'll invite my colleague, Mary Dinnigan McCauley, to answer that.
My apologies. Can you repeat the question, please? Can you repeat the question, please?
The question was, given all of the information I just shared and your belief that access to coverage and provisions around coverage that makes it more difficult for people to get MAT, is this something that you believe would be made worse or better if the ACA was overturned?
Well, GAO certainly would encourage any increased access to treatment, and Medicaid is one program that does does improve access to treatment. So our concern would be ensuring that that remains.
Do you have any estimates of how much was provided by Medicaid or how much was spent by Medicaid on such treatment?
We do not, but we do know that in those states that had Medicaid expansion, that there were more people that had the access, but we do not have a number.
Thank you. And Director Carroll, one of your goals listed in your performance reporting supplement is that increasing the percentage of specialty treatment facilities providing MAT for opioid use by 100% within 5 years. I recently visited one such facility in my district. It seems to be a great program, but they spoke extensively about the challenges around coverage. And the majority of their patients are covered by Medicaid, and others are covered by health insurance that in many cases they did not have prior to the ACA. So my question is, if the issue of coverage is exponentially exacerbated by a successful overturn of the ACA, how do you think you'd be able to accomplish this objective?
Thank you. What's important, I am bipartisan on this issue. We have to save lives regardless, and providing treatment to everyone is critical to do this.
Well, and to be clear, I'm not making this about partisanship. I want to know if I'm concerned about what the courts are going to do. So I honestly want to know what is going to happen if the ACA is overturned.
In terms of, first to talk about the Medicaid and the reimbursement, and as well as health insurance, we have to make sure that it's sustainable going forward. And so to be able to give states the authority to help more at that level than at the federal level to determine how they're going to provide treatment for people, I think is critical. And one of the things that we're also seeing is making sure for those people that do have insurance under the ACA, what we're seeing are copays that are so high that it's really not effective. And there was a report this week that was talking about copays for individuals under some of the ACA plans. I think it's $6,000 or $8,000 per year and $12,000 for families. And at that point, you really have to wonder whether it's working or not.
Right. Well, I mean, in large part, that's because of the increasing pressure we've seen from other attempts to undermine the ACA, that the costs have gone up and copays have gone up as exponentially. But for me, I'm wondering, and I don't know if this is possible to request, but I would love to see some contingency plans or other efforts from GAO and from your office on how how such an overturn of the ACA would affect treatment.
I'll see what we can get you as soon as possible.
Thank you. And with that,